No, what,
Maya needs
this
to
one?
hang out
Yeah.
with
Okay. And where's the video part? Am I going to see it anywhere?
When you go forward on
Well,
your
she's
button.
still over to.
Okay, but I mean, as far as what they see, as far as me, or we're just going to do the video?
We're just doing the slideshow.
Okay,
But like
perfect.
the one that walks with
Okay.
her is just kind of craze.
And we have a couple people on, you said?
Yeah,
Motivation is just pulling your arm out of the
I know, right? I wouldn't take her for the longest time after my neck
Okay.
surgery because.
Hi, everybody that's
she pulled me
online.
over.
I'm going to show you the PowerPoint presentation first. And then can we come off of that and then show Maya at the end? Okay.
Absolutely.
Perfect.
Can they touch Maya online?
Yeah, can you
Figure that
touch
part
Maya
out.
online? This is very informal, but you're going to get some really good, valuable information. And it really is towards instructors. Dean Rue and I actually talked about this a couple of years ago, incorporating it somehow. And like, you know, we were just saying, wouldn't it be nice before test taking for those, because you should have seen all the kids coming in the office today, like, oh, Maya's here. And it's a big deal to even get her on campus. They have to go through all the security parts. We have to show our vaccinations, our insurance. We have to show that she is a registered certified dog to do this, versus the other different kinds of dogs that are here. So I'm gonna start off right away with a video. I hope those online that you're able to hear it as well too. So how do I get it going? You did it before. What do I hit?
And then click it again. And then it's
Kind of looks like Maya. One thing that's really different with our program is that our therapy dogs have to be at least 2 feet apart. We can have as many as we want at any information that we have at any given time. But on this one, they must have some kind of permission to do that because there are lots of rules and regulations. I'll show you at the end, but this is our member booklet that we have to abide by with all of the different things that we submit and doing that. I want to start with the definition because people get it confused all the time. The actual is called animal-assisted interventions for pet therapy because there are many different categories underneath this. But it's to help people from recovering from an illness, positive coping, improving that human physical bond that is there. And it's really a complementary or an integrative form of therapy in medicine. It can be done in groups, as you just saw, or it can be done individually. And Maya has done both quite frequently. The value of it goes on and on and on. It has been shown, and I'll show you more as we go through too, but it actually has been shown to reduce overall costs of extended treatment because of the mental health component of it, both physical and psychological, as well as improving patient satisfaction. So it can actually may shorten the length of stay and has been in an augmented role in some nursing programs across the United States. When we talk about the animal-assisted interventions, the animal-assisted activity is what Maya is. She's the meet and greet. It's all volunteer with everything we've done. It's not part of my job at all, but it's that really for motivation, improving truly quality of life. And in every kind of environment, it's amazing where you can see these animals. And there are many different kinds of animals, not just dogs that are there. The animal-assisted therapy becomes part of the human's job. So people that are social workers, that are doing, librarians have them. There are nurses that actually use it as part of their treatment plan, but it's goal directed. And the one that I know around here is that we do have it in the social work department and also in occupational therapy that are there. So it becomes part of the treatment process and maybe either, again, through a group or individual process that is there, and it includes the documentation and things. Maya does hospice visits, so I do have to document there, but in general, because there's so many people we see on a day-to-day basis in other areas, I don't have to do any documentation. When we look at this, then we know that there's animal-assisted education component of this as well too, and also for residents that people have it. So like at Valley 4000, they have a dog that lives on campus all the time, and that's the live-in animal. With the animal-assisted education, this is again part of the plan intervention. It isn't just the happy cakes thing. It's really what is all the possibilities that can be done with that. So there's a lot of research that's being done in this area that's very interesting to watch. Back to the live-in then, this is usually owned by a facility, but there are people that have been designated to take care of that animal on campus. Obviously, you let them out, you know, where are they allowed, where are they not allowed, but it's done in so many different areas, and it's so fun to watch when that goes on. It can be done formally, but it has to be done through proper screening and training. Not every animal is going to be appropriate for this. Service animals is different, and this is where a lot of people get confused. Even like today, you saw Maya came in with her vest on, and right away people think it's a service animal. That doesn't make a service animal. The service animal is, you think of the letter S, works with solo, one individual. So we have guide dogs. They're highly individually trained. They can be anywhere over from $20,000 to $40,000 for their training process. It's not necessarily a person's own individual pet that becomes this way. And there's a lot of training that goes on with this. And it's from everything from physical, sensory. Service animals are now finding cancer. They treat for people with diabetes. They do all kinds of, it's amazing the things that they do. And they do fall under the Title II and III of the American Disabilities Act. So this animal can go along with that person wherever they are. So that's another thing. They do always recommend that they do have some kind of identification on. And most of the times when you have a service animal, you do not touch. This is a, you know, not touch. They're working just like a job, and they have to pay attention to that individual that they're taking care of. It's usually somebody with some type of disability or actual need. The different ones, like we said, with a service dog, they can live in a housing where there's no pets allowed. They can serve that one person wherever they go. One of my most favorite ones, I've been on several airplanes which had service dogs, companion dogs, and not a therapy dog. Those are the only two that are allowed on the plane. But the two service dogs that were very interesting that I saw, one was a guide dog for a person that was blind and literally walked backwards all the way down, to take that person to his seat. That was very interesting. And just recently, when I was coming back from Los Angeles, there was a service dog that had somebody that was a very brittle diabetic and sensed when there was issues going on with that individual. So it was very, very interesting to watch that. But again, goes wherever that person needs. For an animal-assisted interventions like Maya, they can only be in my regular house. If I took her anywhere, she has to be invited. We can't just show up. She has to be invited. And we encourage to touch. So that's very, very important. So if you think of therapy, thousands, she sees thousands, service, solo, one individual at any given time. So that's a big distinction from there. Big similarities, good temperament. To be a service dog, they have to go through, like I said, significant training and even beyond what Maya's gone through, but it does require that. We are all subject to the state laws that are there. We like to do joy and happiness, and they're always allowed off-duty time. So you can play with dogs, but only when they're off duty at any given time for doing that. So that's it. That's very important things. Age requirements, there's no age requirement for either one. Usually they look at over a year of age for doing either one of these activities and interventions, and then the training that goes on. There's working dogs, which is another category. Like we know the canines that are there, the sniff and the farm and herding dogs. My daughter was just at an airport where they were doing a sniff dog, and not watching what's going through because there was such a rush of things going on. And she didn't do anything, but she just stood there. And they said, no, you have to keep moving. She got all nervous, like, oh no, because the dog stopped and sniffed her. So she thought that she was going to be watched at the given time. Have you guys been through the sniff dogs yet at all at any of the big airports?
I noticed that in Las Vegas, they just had the dog inside of a roped off area and they would constantly go to her around in a circle.
Correct.
And as people went around the rectangle, they would just constantly be sniffing.
Right.
Constantly.
Right, but you don't stop for
So-
them. They will you know,
Yeah.
alert and stuff too.
Yeah.
If you ever watch any of the cop shows on TV or, you know, live PD or any of those things, they show it a lot, these areas. Sled dogs are also considered a working dog. So the dogs do have, you know, that ability to be trained to do a work, which is different than a service versus different than interventions. The other category that's most questionable these days, I'll be honest, is called the emotional supported companion dogs. And Maya's my emotionals. I mean, every animal, a person has a pet, that's kind of what they're doing. But it's usually for a medical treatment where they actually have to have a prescription or a doctor's order specifically to take them places and to be able to have them in housing. However, they do not require any kind of specific training. They don't have to be socialized. They don't have to, you know, do anything other than to work with that individual at any given time. Really, distinction then is it can be any temperament. So you can have a very, you know, dog that's very protective of the owner, but not anything else. They can live in the no pets area, which again, like I said, for Maya, that we're not there, but they don't have to be certified. They don't have to be registered. They don't have to have any training that is there, and they may or may not be allowed to be touched by other individuals. So again, that's a very, there have been several issues with emotional support dogs where people have called them service dogs, but they were actually emotional support dogs with injuries like on planes or next to other people, because they're not trained or under the same restriction of what they are. All of the dogs are supposed to be on leash unless they're, like Maya has permission to be off leash for different activities that she does. Again, similarities is that we want to still bring happiness and joy with our area that are there, subject to state and animal rules and regulations, even though not everybody has licensing that we find in Grand Forks alone. But allowed to play and be off duty as well. When we're looking at the difference, there are many, many different animals that can be. So it can be any shape, size, age. From therapy dogs in our community, we have approximately 30 right now that are active. There's some that have either resigned or have died or have moved on or whatever. But the smallest one we know is a miniature long-haired dachshund named Luna. And if you ever want to see it, she's at Treat, Play, Love. And she's just a dolly doll. The oldest one that we had was her sister, who just recently passed, and she was 17 years old. So a set age, usually from 1 to 17 or whatever. Parrots, of course, live a long, long time, so you can see anything with that. But it has to meet the health standards and the laws of the state, and they have to pass a test before they can interact with other individuals. So specifically for those that are in therapy like Maya, she had to go through the beginner, intermediate, advanced training. Then she became what's called a canine good citizen, so that she can be around other animals and crowds and know how to work with, you know, any other individual and other animals and be at alert with, instead of jumping and barking and, you know, chasing and all of that kind of thing. So that's what canine good citizen is. Then they go on for the American animal-assisted therapy or animal-assisted activity. Maya, actually, I had thought about going on for the therapy part, but I've liked it in the volunteer role. So I've liked keeping her that way. And then we have to meet facility requirements. So not only the training we have, but it's different, like if we go to visit at Valley Elder Care versus if we went to visit at All True versus if we went to do home hospice visits, obviously. So there are different rules and regulations for each one of those for policies. Every kind of animal is out there, which is just amazing. Somebody just told me that they were working with getting a spider, you know, one of those like tarantula spiders. And I'm going, I don't think so. And snakes, because you don't think of, you know, most of the time it's something that interacts and has fur more than that. But aquariums have been studied for years and years and years of the benefits of doing that. The dolphins, they're doing more and more with that area. Llamas are there. Pigs, they have everything from the little pigs to the big pigs that are out there for that. Goats and horses, so there are many. Bunnies, and even, like animals you really don't think about with that are there. The responses that we see, these are the things that we, based on the type of animals that we're looking at, some of the evidence that's there, that dogs actually build self-confidence. That was a really interesting study that I looked at with not only the communication, because it's been so interesting. On 3 occasions now, Maya has gone to somebody that has been basically nonverbal at the nursing home, and all of a sudden they're talking to Maya, and they just go, whoa, just very exciting to see that. But the whole, how it does work with that self-confidence that we have no, understanding for it. Where's the intrinsic component of it? That's very hard to see. But they know with lowering stress, stimulating exercise and activity. Maya has gone to many times at rehab at the south end now. It used to be at the rehab on campus here, where the physical therapist would be like throwing ball. Maya will retrieve a ball. And so somebody loves that interaction and just playing with her, and they don't realize that they're actually working. I remember this young man, he had been in an accident, and they were really working with upper body strength. And he finally was even standing up and starting to throw the ball. It was really cool to watch. Horses, again, they've done studies with this, post-traumatic stress. I hadn't seen that one before. And eating disorders. I thought, a horse and eating disorders, what is the correlation there? But they're finding all this all the time with that. The cats, again, with lowering blood pressure because of, the purring and all of that for people that are not allergic or fearful, right? We're always looking at that. Birds have been distraction for a long time. And even that in the world of bird recognition, when people are doing bird watching and things, not only the ones that are in captivity. So it's very interesting to watch that. Fish, same thing with stress relief and also helping with dementia. How? I don't know. That's where it's so interesting with this. For a dog to be here, like I said, they're usually over a year of age. They have to be in good health. They have to have a good temperament. They have to be trainable, and they have to like people. Now, not all animals are that way, and so it's very interesting to be looking at that. They have to pass that canine good citizen. I had to take a written test. I didn't think it was fair that Maya didn't take a written test, but we have to have testing and observing, and they do more gross things with them. They, where they are doing like touch or loud noises or things that may or may not ever occur, but to watch that. Maya was trained through both Pet Partners and Alliance of Therapy Dogs. There are 3 kind of national ones known here in our country, and then there are many other subdivisions of those. But through Pet Partners, Maya became basic, and then she went on to complex. So Maya's allowed to go like into intensive care units. We have gone to traumas. We have been to many different things because of her response. As you can see, she's pretty calm dog with where we're doing that. So we have to get registered and certified through different organizations that are there. And then the whole idea of being invited, that the visit there's an awareness of our visit and when we're coming. And I think that's a good idea about the test taking, that we'll have to come up with a plan for that. Behaviors when they're working then, again, Maya had to learn all kinds of things from different flooring, vibrations. She learned escalator and elevator, which was very interesting. I didn't think she'd ever do an escalator, but she has done that. How to work with groups of people, different sounds, noises, different age groups. There are some therapy dogs that don't do children, which I thought was very interesting, that they go to elders, and if they have like their grandkids there, they won't go in those rooms. So different animals have different ways that are there. But the sudden touch that is there, dementia behaviors that are there, Maya does excellent with dementia. It's just amazing to watch where we are. Maybe that's why she's good with me. Who knows? But the whole not jumping, barking, they can't be nipping or chasing. If Maya did any of those things, that would, she would no longer have to do that, or she'd have to go through testing again and go through that. By, again, learning the equipment, Maya can also get up on a chair. Maya, I'll show you at the end. We'll finish the slides and then we'll do that so everybody can see that. But how her skills are for what level that she can be at. Leaving human food, that's a hard one. And so that's a dog drive and stuff, so you have to be on alert with that. And then accepting a treat without biting, and I'll demonstrate that as well too. Within the facilities, there are definitely realistic programs and goals. They have certain standards that need to be done here. Maya needs to be clean and well kept before we do that. We have to have her supervised by a handler. I can't just pass her off to one of you at any given time. And if we see any stress in the animal, we have to protect her too, because nobody else is going to do that. Maya at times has rejected an individual. And we don't know exactly why, but we just move on when it's been that way. But it doesn't happen all the time, but we're always looking out for her well-being and health as well too. These are all the different kinds of certifications and registrations that you can go through. Maya has been involved with the Pet Partners and the Alliance of Therapy Dogs, so that the middle two, the one on the bottom with that. But and then the Therapy International, those are the three pretty well-known national ones that are there. Pet Partners used to be called Delta. If you go back to the time when it started back in the 1970s and 80s is when it became very popular for learning this. This is a lot of the academic affiliations that are out there that have some animal and human health certificates where you can work together with that, which I think is just awesome. I was so excited when I did some of the background check on this and did some researching on all these different areas that can be there at any given time. So it's from medicine, nursing, social work, psychology, education can do it, all kinds of integrative studies. Research is being done all the time. Combinations with veterinary medicine as well can be there. Organizations that promote it, the newest one that I just added was Mayo Clinic. I would love to be able to bring Maya down to Mayo Clinic. You have to pre-arrange that because they do have animals on campus at all the time. Maya has gone to other sites as well, but again, you have to pre-arrange it. I carry with me on my phone now a copy of all the information that they would need at any other time. But it's just so interesting to see all the studies that are being done. And this is growing. It's a growing field, which is so fun to see. It's not going away anytime soon. There are many different kinds of careers you can do with animals. Volunteers is my area. It's not really a career, but it's something that I really, really like to do. When I was a very young person, I'd always wanted to be a veterinarian. I thought that was going to be my area until I found out that you have to humanely euthanize animals. I would have had to take them all home with me. That would have been very hard to do. But there are all kinds of different things that can be done with the animals and animal-assisted interventions that are there. There are so many benefits of animals, except for those people that are extremely fearful. But sometimes you can even work with that because of either past experience or some of that as well too. But because animals are non-judgmental, they're not going to be doing that. It actually helps to improve their self-esteem and security and the ease and ability of just being able to touch an animal. You can be walking by, and it's just interesting. By the time from when I'm going to do visits at the hospital, Maya's done over 300 hours at the hospital now. But from the time we leave the car, just to get into the door of the hospital, how many times she's already interacted with somebody. And it's just a little bit different than what they have seen with therapeutic touch. There's actual theory and research now about the endorphins that are there with the oxytocin, excuse me, I'm not talking well today, part of it. So that does help with this tranquil mind. One of the interesting things when Maya's been in rooms that have monitors on, we watch everything slow down. It's so appropriately, but they start a little excited and then they come right down. So they've seen all kinds of things with where it goes with hormones and anxiety as well too. Physiological, we know that it has helped with blood pressure and breathing and pulse and effort. How it lowers cholesterol is beyond me. I've been kind of watching that one. I thought, wow, come on, Maya, help me here with that. But the whole idea of all these different things that it can help for doing that. Definitely with helping motor skills that are there, the involvement, social skills that can help with that too. Especially people that are socially awkward, they might do much, much better with an animal. And that can be from a point of an animal-assisted intervention, from a therapy to emotional support or even service. So any one of those areas can be from that perspective as well. I like this one. My therapy is quite simple. I wag my tail, lick your face until you feel good about yourself again. So my therapist has a cold nose at all times. It's kind of fun to do that. The emotional and psychosocial, the list goes on and on. It helps with calming in many different capacities. It's just really, really fun to do that. Reduces boredom, increases attention span, means for touch, especially after people that have had post-traumatic stress and have had those kind of issues with that, and reinforcing contact with individuals. But unconditional acceptance and humor, I think, are very important, which we don't always think about in healthcare, and how important those things are as well, too. Elderly, it's been studied quite a bit with the elderly. Scores have improved with some of the cognitive things, their socialization, where they are with health and activity. I've mentioned several times about specifically with dementia, or those people that have had some kind of cognitive impairment issues that are going on there, and involvement and feeling of value, especially if they're being involved, that they feel that they have something that they need to take care of. Other populations have been studied, autism, aphasia specifically, which it's amazing to watch them trying to speak, even though they might have come from other speech therapy interventions in the past. And Down syndromes, Maya worked with a little one that was about 2.5 years old that always wanted to touch Maya with her feet. And that was it. And so we worked with how to take care of living things and working more in an interactive mode. I think many of you might have seen that YouTube with the little child, and the dog keeps coming closer and closer with it. The newest ad that's out there now is a child that's reaching their arm out to, okay, I'm ready for my chemotherapy or whatever treatment, and then the dog comes in and her face just brims. It's so cute to see these different ones that are there. We do know that with every positive, there might be a negative, of course. The biggest ones we're concerned about are elders or people that have animals, and the animals get in their way, so they can sustain a fall or have a fracture either from dog walking or just within their house. So it's very, very important to make sure to do that. If it's perceived as a threat, if someone sees an animal as a threat, especially if they've had any interventions with service dogs or canines that are working dogs, where in the past they know that a dog can be very aggressive and do some things. So there can be inappropriate interactions with aggression, because not all dogs are in this capacity. And so people go to the dog park and think every dog should be like Maya, and not all dogs are like Maya. So it's very important. They can also have very much over attachment to that. So if the animal dies, because animals do not usually outlive humans, that can be it, or it can go the other way. When President Bush, when he had his service dog that was there at the funeral, I don't know how many of you noticed that, but that dog was going to be retired to a VA, and I thought, oh, perfect to be rehomed that way. There's definitely allergies, and it's different types of dander. Not every animal has the same effects, so people try to get like the hyperallergenics. Not every animal still will be perfectly without allergies. There are infections that do cross from human to human. Most of us, the common cold, thank goodness it doesn't. I get that question asked a lot from me in the research area. And then there's always the fear and dislike. One of my most interesting questions ever asked to me, I was in the emergency room, and there was a young 2-year-old or 3-year-old toddler that was kind of eyeing Maya. So I went in the room, and they were from another culture in another country. And the first question that the gentleman asked me is Maya edible? I mean, seriously. And it was really hard to keep kind of a straight face at that kind of question at that time, but how important it was for that. So there is always going to be that. I've also been told that animals belong outdoors, nothing should be brought indoors. We get the whole gamut from that. But I've also been invited a few times to orientation at different places where they're intervening and they want to have animals. And so this was a great way for them to meet for the first time with where we are with that. There are cultural and religious beliefs with that, and definitely the patient's condition. We do not go into any rooms that have isolation or anyone that has that component that may add to more stress to that individual. Our nurses' responsibility, in our field, we as nurse educators need to really promote this, to tell people that it is alive and well. It has been well researched. I have several slides that show all my references and resources that I do from the nurse managers, patient advocate. And so we encourage people to like through Maya, she goes through the volunteer services office. So we leave notes, and let people know if you want visits, let us know. And we come and go where we are with that. That definitely for part of the team, because like I said, there might be people that are using them as part of their actual therapy versus assisted activities that are there. There's all kinds of research specifically on the pediatric and elderly. I actually thought in my free time, I might have done that, but there's just so much that's there all the time. And they do know that there's need in the critical care and community settings. More and more research with that because they're seeing more and more from that perspective. I have been in touch with 3 nurses that I know in Wisconsin and Minnesota area that actually have them as part of their job, that it is part of their workday life that they have that. Infection control, we always have things, that we all do. I carry my lint brush, I carry my hand sanitizer all the time, any kind of wipes that we do, because not everybody's going to be very comfortable with that. And especially when you're in a healthcare facility, you want to encourage that. Even though they say, oh, I touch dogs all the time, we still want to encourage that. So it's important for us to have that responsibility to do that. When we do this, we know that it's a positive distraction for people. And so it's nice to include it somehow, especially if like there's stress coming up, if there's something. Our child life specialist has used Maya and others quite frequently, like when children are going for a procedure or something that they're fearful on, that Maya tags along. We put another leash on Maya, and the other child will have the leash and feel that they're leading her, which is very good. Working with ADLs, as I already mentioned, with all the systems that are involved with this, some of the coordination that's there. I'm kind of repeating myself, but I just wanted to show how important it is, especially with these different interventions that are there. Healthy People 2020 and animal interventions. That it does include help with the physical activity there, physical well-being, the whole idea of nutrition and more exercise. If you're involved with an animal, you have that responsibility. It makes you more responsible to do that as well. Definitely in the mental health and mental disorders that are there, depressive episodes have been decreased with that. The loneliness and sadness, you're never alone. Even though I live alone, I never live alone. I always have 4-leggeds around with me as well, too, with that. And then heart disease and stroke, that it does improve cardiovascular health and pet and touching. They actually have found just the stimulation of touching the hair is what helps to stimulate oxytocin and the help to reduce the anxiety that is there. So to include it in our plan of care. And how many times have you seen animal therapy or any kind of pet visit or anything on a care plan? Anybody ever? Down in the Twin Cities and Mayo Clinic, they're starting to see it a little bit, which is really, really good. And then, like I said, Maya's included in some of the hospice visits and some of those other ones as well, too. On healthcare professionals, we know not only is it the people we're taking care of, but it helps us too. And you saw at the very beginning with those nursing students working with them, but it helps with patients and family members, visitors. You never know whose your life you're going to touch. It's very, very interesting. So it helps with morale. I got a very nice thank you note from the emergency room saying that one day it was just a very stressful day. And after Maya came in, we started in the waiting room, and then we came back to staff, and then we did see some patients. The whole morale had improved. And I got it was signed by 3 different people from that emergency room department, which was really, really cool. Collaboration, including the animal. Is there some way that we can do that? And pain management, definitely for distraction and helping for guided reality instead of imagery, because this is real. And animals still definitely real. There's no question for that. Okay, how do we get this one to go? Just hit it again? Nope.
It's a video?
Yep, it's a video. I'll let you do that one. There we go. You hit onto the button.
Trying to find the mouse there.
Here we go.
or even a staff member, and now we go to one person first, and then, they round and kill the other one. That training involves both of us, and we both get tested off of the days of time. You have to do 7 hours, you have to have interaction, you have to get used to sounds, smells. You feel happy. Because I love dogs and they can reduce the stress, they can help with easing loneliness, they can transform the environment to a more positive mood. But I think the biggest gift they give actually is bringing joy and unconditional love.
So Maya hit the news. As I said, this isn't just Nancy's thoughts on things. I did quite a bit of resourcing and references for all of this, with where they are with all of it. Hospice nurses, human bond type things, international association, certification. Mayo Clinic had a 2016 one on pet therapy animals as healers and has a whole section on that too. The role of pet therapy in patient treatment, animal-assisted interventions in dementia, many different sites. So I wanted to pull it together to show you that there is some really profound research and evidence behind this to make sure that people are doing what they need to do. And that was a new segment from 2015. There is no requirement for when a therapy dog retires. We just watch to see how they do. Maya's slowing down. We used to be able to do 2 or 3 hours at a time. We can do about 1. We're finding that part of it's probably my slowing down as well too. So.
I have a question.
Yes.
On one of your slides, you had SNF as something.
Skilled nursing facility.
Okay, good, thanks.
Thank you. Gotta always watch my abbreviations. Maya has her own therapy bag. So is this following us? No, can we bring it around? Since Colleen is the closest, I'm gonna. I'm gonna take off her vest because it's a little hot and tired for her. Come on, back up. I know, she's getting bugs. Can we do this thing first? Come on. There you go. So this was a skill that the child life specialist taught her one time, and she's done it ever since. It works so good when somebody's in a wheelchair or in a hospital bed, because then they're at eye level, versus having to try to reach down. Maya, can you shake? She's doing better, right? And she's ambidextrous, and she does both sides. No licking, Maya. Yes. Yes. She has, anytime she's on service, she has to wear her tag that says that she is a therapy dog. I also have, because people get confused with having the vest or not, I am friendly, ask to pet me, and that's what we want to teach people. Always ask, just don't automatically go. Not every animal is going to be that friendly. Maya down. Maya. Maya, come. I know you like Colleen, but we're coming down. She knows Colleen. On this table up here are many of her different scarves that she wears. Some animals, Maya. Okay. All right, come on. Let's go down. Are many of the different, Maya's, well, she's gonna go say hi. Maya doesn't necessarily wear like outfits, like things on her head or anything, but we've done scarves. Many students and stuff have made different things for her when we've gone to Camp Good Morning. They make different things with her names on it and stuff. When we go to the hospital, I have my ID badge, but Maya has her own. I'm gonna let her go.
I noticed that in the video.
Huh?
I noticed that in the video that she had her own
Yep, she has her own name tag.
volunteer.
Picture ID, but it doesn't have the swipe on it.
She can't get in and get.
She can't get into any meds or anything, no. Maya, where did I put it? I just put it. There we go. So this is Maya's new ID, because we had to go with the new IDs that are there. So that's her new ID that's here. We also have calling cards, and we talk about therapy on the back. So it's a little bit about Maya, and then it's a little bit about therapy. And those online, if you want one, I'm in room 320, just stop by and I'll have extras there for you as well. Maya wrote a book called Through Maya's Eyes, you know, the life of a therapy dog. And we were very lucky because we had local students from the high schools do artwork for her. Books. I'm going to show you a couple of the different ones. They were ages 14 to 18, and that was the best part of this. They did photographs with her ball, of course. She loves her ball. This was done, this next picture I'm going to show you was done by a 16-year-old. 16 years old.
Wow.
Does it not look just like her? Except for the gray. She's got a little more gray. And the next one that I want to show you was done by a 14-year-old who didn't think it was worthy enough to be in the book. You ready? Everybody ready?
Wow.
So what we did was we made it a big event. We went to Altru, and in the main entrance there in the lobby, we had a book signing. And Maya came and she did stamps for the book. And we actually put a page in the book now that has her actual footprints in it, because everybody wanted to see that. And we had the students write that, and they learned so much more about the difference in therapy dogs. So I hope it touched their lives. The very first reading I did with this book was at the School for the Blind. And it was so interesting because everybody got to touch Maya. Some of them were low vision, but in general, they were able to interact with her and ask many, many questions. It was very profound. It was very, very interesting to do that. So no, we're not planning a sequel on the book, but it's been fun. So Ferguson Book has it. It's been fun. It's on Amazon. You can go on Amazon, and Ferguson has it, and Tree Play Love, and the hospital gift shop. And Maya sold over 500 copies, and the majority of it has gone back to the therapy dog groups and stuff too. So, other to pay for it. We also have Altru finally put together a little information thing about their therapy dog program. And we do have, I think we have 7 or 8 dogs right now. Like I said, it changes over time. But we have a Facebook page now for the Grand Forks therapy dogs. So if people are putting in requests, they have routine ones that are done at Altru. We have ones that are done at Valley Elder Care. Come on, you've already said hi. Here. And I do have lint brushes too for you. So questions? Do we have questions? Any questions online?
Question. Do pet therapy dogs need to be spayed or neutered? Is that a requirement, or do they allow them?
No, I don't know that. I just automatically did. I'm going to look in my handbook and find out.
Yeah, I was
You would
just
think it would
curious.
be advised, you know.
Yeah.
Maya.
I mean, it would be difficult for a pregnant dog.
There she is. She's trying to shake.
Yeah,
That's what she
and
tries
the
to do.
hormones probably make them more.
That's a good question, though. I'm going to look at my handbook. Maya is, so
Yeah.
that was not a
Yeah.
question at all. So I guess I must overlook that one. We have to test every year. We have to take a test every year again, just for updates and things too, like the They always have the 2 foot apart rule, you know, some of those big ones. And when does therapy start? From the minute you leave the car, because you're responsible wherever you are, whether they're parking lot or anything.
I don't see any questions
No
online.
questions?
We're loving on her for you guys online.
Yeah. Yeah, this is a little bit more interactive than some of the ones that you're going to have. And if anybody wants copies of the PowerPoint with the information on it, feel free to contact me also.
And I will be requesting that from you as well, because we have a spot online now in the research office for the brown bag recordings
Yay,
and information.
excellent.
Yes, so we can put the Facebook link,
Perfect.
the PowerPoint.
I'm gonna let you know the date of our first exam.
Seriously,
For a little visit.
seriously.
I think
I
that'd
think
be
even
awesome.
the morning of that,
Yes.
you know, I was thinking the day ahead, but I think the morning of would be
Yes.
really good. And are you guys doing it kind of 3 days in a row then, like they did before with the classes?
You know, we try not to do that, but it just ends up being that way, so, yeah.
Just they're not on the
It's
same.
like a stressful week, so.
Yes. What else can I tell you? Maya sheds, and in fact, I should read my last chapter of my book for you. This is my favorite, one of my favorite chapters. The chapters are very short. They're like 1 and 2 pages long. So her last one is leaving memories with the humans I visit. Although I have to leave humans after visiting, Nancy often, and she refers to me as your human Nancy, Nancy often offers them my bookmark to help remember me. She has told folks that she hopes I have helped make their day with well wishes, speedy recovery, or just goodbyes. However, I always leave them with something to remember me by, some of my hair. Nancy says I shed a lot, no matter how much she bathes or brushes me, or how often I get groomed professionally. Although she brushes me every day and I get baths regularly, there always seems to be hair around. Some humans think it is okay or don't seem bothered. Many others are asking Nancy for a lint brush and hand cleanser. I still think humans can be so silly at times, but I will keep doing my job as long as Nancy takes me to visit. So now here's another one of the pictures in the book. So it's a picture book, definitely. Now here's another. When she was a little bit younger, they found a real cute picture of her.
Oh,
at a
that's
younger-
very cute.
Isn't that cute? So we had fun. If you ever want to look at the book, it's up in my office. It keeps me going a lot of times too, so.
Thank you.
Thank you.
Yes, thank you. Wonderful.
They have handouts like when you're going to different places in my old ones now. But these were from the Delta Society about the differences between service dogs and therapy